I'm going to be doing the intramuscular injection of the deltoid. So first, I would prepare and administer the medication according to the 6 rights of medication administration, which are right route, right dose, right time, right medication, right patient, and right documentation. And then I'm going to check the physician order and the MAR for all of the 6 rights. And then I'm going to get my vial of medication, and I'm going to check the vial for any cracks, particulates. I'm going to check and see if it's a multi-dose vial, and if it is, I'm going to check the vial for the date, time, initials of the nurse who opened it, and if it's past its 30 days of being good. And then after I've checked the vial for all of that, I'm going to select the appropriate syringe and needle, and I'll do that by considering the volume of medication that needs to be administered, the type of medication, and the patient's muscle mass. And then I can mix the medication if needed by rolling it in between my hands, and I wouldn't shake medication. Okay, so then that's going to be down there, and then I'm going to clean the top of the vial with an alcohol prep pad. And then I'm going to get my needle. I'm going to be using a 3cc syringe with a 22 gauge needle. So get that. And I'm going to uncap the needle, maintaining sterility by not touching the tip or the shaft. And I'm going to draw air into the syringe equal to the amount of medication that is going to be administered. So I'm going to be doing 1 milligram. So I'm going to draw up 1 milligram of air. So I've got 1 milligram of air, and then I'm going to still maintain sterility and insert the needle into the vial and inject the air. And then I'm going to bring the vial and syringe up at a 90-degree angle and slowly withdraw the medication equal to the amount that I'm going to be giving. So I'm doing 1 milliliters or milligrams. So I'm going to do that, and I'm going to check and expel any air bubbles. And I'm going to remove the needle from the vial, still maintaining sterility. And I'm going to stabilize the vial. And then I am going to bring, I'm going to check that the correct dose has been, I drew up the correct dose, so I did 1. You can see that. And then I'm going to recap the needle using the one-handed technique, and I'm not going to touch the tip or the shaft. And then I'm going to go to the patient's room. So I am in the patient's room, and I'm going to identify the patient by 2 patient identifiers, so patient's name, date of birth. You could use the medical record number I'm going to be using the patient's name and date of birth. So I'll ask the patient's name and his date of birth. And then I'm going to locate the correct injection site. So there are two ways. You could locate the injection site by the lower edge of the acromion process and draw an imaginary line to the middle of the lateral arm, and then the site is the center of the inverted triangle. So you would locate that and then do the triangle, and this is the site. Or you could place 4 fingers across the deltoid muscle with the top finger on the acromion process. And the injection site goes 1, 2, 3 fingers below the process, the middle of the upper arm. So I would do it like right in here. I'm going to be doing it on this. So I would position the patient with the arm placed at the side or resting on a firm surface, and I would completely expose the upper arm. I would have the patient sitting, and then I would put on procedure gloves. And then I would get another alcohol prep pad, and I would cleanse the site, starting inward and making circular motions going outward. And then I would allow the site to dry. I wouldn't dry it myself. I would just allow it to air dry. And then I would uncap my needle with my non-dominant hand, or I would uncap the needle, maintain sterility, and then I would hold the skin taut with my non-dominant hand, and I would hold the syringe between my thumb and finger, and I would aspirate. If blood returns, then I would start over. And I would insert the needle at a 90-degree angle quickly and smoothly, and then I would aspirate, and if blood came out, I would start over. And then I would stabilize the syringe with my non-dominant hand and inject the medication slowly over a period of 5 to 10 seconds. And then I would move the needle slowly and quickly, and I would dispose of the needle in a sharps container. I don't have a sharps container, so I'm just gonna put it over here. And then I would blot the site with gauze and apply light pressure, but I wouldn't massage it. And then I could cover it with a Band-Aid if I needed to. I would document where I injected, so the injection site and the dose and the type of medication in the MAR, and then I would document any reactions that the patient had, and I would leave the patient in a comfortable position with his call light and make sure all of his needs were met, and then I would clean up everything and